Hi guys, I'm Dr. Kristin at Elk Ridge Chiropractic. I just wanted to show you guys what a manual adjustment might look like on an infant. I know a lot of you know us as the activator doctors, which is great, but sometimes I like to set the tool aside and just use my hands to deliver adjustment to the little ones. So as babies, they've gone through a lot through growing in the womb to the actual delivery itself. And so on top of that, they're doing a huge amount of development and growing between, especially the first 5 years of life. So as a chiropractor, I'm really honored to be a part of their journey, like Sammy's, and helping them grow and develop at the best way that they can by keeping their nervous system clear and connected. So I just wanted to show you what a manual adjustment might look like, as I said. So let's get started. You ready? Oh. Can I flip you? Thank you. So I just have a pillow here that I like to put the babies on while I'm doing an adjustment. It just takes any sort of risk of falling out of the equation. Hi, Smiles. And so with the baby, it's obviously hard for me to ask him, like, how are you feeling today? How are things going? And so I just tend to do kind of that stuff on my own. So we start at the bottom and I just check the hips and kind of move them around, huh? Yeah. And then go to the back and just see how that joint is moving. They tickle. Sometimes when children are having issues going to the bathroom or have some extra gas in their system, I'll see issues down in the sacrum. So I like to make sure that that's good and moving. And once I find a spot, I just take a contact and I just kind of move the leg through the range of motion to get it back moving. What do you think of that? Yeah, I know. All right, and then once I feel it's moving again, I just keep working my way up the spine. And just looking for spots in the spine that don't seem to be moving as well as they should be. You're such a good boy. Yeah. And once I find a spot again, I just hold a little bit of a contact there until I feel it slide back into place. Yeah. Yes, let it go. I know. All right. And then once I've worked my way from the sacrum up through the spine, I like to flip baby so I can get a better feel at their neck. Yeah. Can we turn you around? Oh, I know. Hi, what do you think? And Sammy's doing a great job. Sometimes babies will fuss during this just because, you know, here I am invading their system and their space a little bit. How does that feel? And especially when I'm working in the neck, I'm not using a whole lot of a pressure, probably about the same amount that you would use to test the ripeness of a tomato. It's okay. You're doing great, bud. Okay. I know. What's over there? Okay. And as you can see, sometimes baby gets a little fussy. Totally normal. Sometimes they're just tired of being in one position. Hi. There's the Smiles. And sometimes they just have a little bit of a sore spot that I find, and once we work through it, it's all smiles. Oh, I know. With that, we have a well-adjusted baby.